I became interested in training for LANAP to become a LANAP trained and certified clinician by working with some other doctors who have learned about the technique by reading up on it, seeing the benefits of laser use on patients, seeing the results that it gives, which are really amazing. I personally did not like using lasers to begin with. I think that they take a little too long and there's a lot of odors and things that go on with them. But after having been exposed to the training with LANAP and the Nd:YAG Millennium Laser, I've come to learn that that is no longer the case. It's very easy to work with, it's a very quick procedure, and my patients couldn't be happier about it, nor could my back. So my impression of the training that we're getting here is really great, honestly. There's a lot crammed in, certainly, but it's very manageable in terms of workload, and we're learning so much that actually applies to our patient care, which is really what the take-home of this needs to be, so that we can do a better job for them. A lot of things have surprised me about working with the LANAP technique and the periolaser. Mainly patient recovery time has been really almost non-existent. Patients go straight back to work afterwards instead of, having had traditional flap surgery done. The results I see on the x-rays, without necessarily using any bone graft material, my patients are getting their own bodies to regenerate some bone and blood supply and gums. So they're happy about that. Materials are down. It's your own body's material, really. It's your own collagen, your own blood. It's working hard for you. Once the numbness wears off, they maybe take 1 or 2 Advils, to feel better about the situation, but really they're fine. They all come back to me and say that they felt maybe a little sore from the procedure itself and, having had dental work done for a few hours. By the next day, most patients have said that they were feeling almost back to normal. They have to remind themselves consciously not to chew on the side that I treated. If a colleague asked me if they should become LANAP certified, I would say 100% yes. It is an amazing technique. It expands your scope of treatment for your patients, so you're not limited to any one technique or any one mindset, but you keep a very open mind and you're able to offer so much more. I have a patient who is a early to middle-aged patient with aggressive periodontal disease. They have very conical roots and about 50 to 70% bone loss in all of their teeth. That's a situation where I would be extremely skeptical to try traditional flap surgery because the anatomy of the teeth and the bony support is so minimal. Opening a flap may cause the teeth to completely lose stability and be lost. We treated this patient with the LANAP laser rather than traditional flap surgery, and things stabilized really well. The tissue's tightened. There's not that much recession, so a lot of the gingival attachment went back to the tooth, as well as some bony regeneration, and the patient is able to bite and chew. And if they do want orthodontic treatment later, I don't feel worried about the amount of bone loss or all these black triangles and spaces in between their teeth from having their gums pushed out. It's actually been quite life-changing for that patient. No, it's a great laser. It has so many applications. Being an orthodontist as well, I do a lot of my own canine exposures. I do a lot of my own extractions. I don't only use it for the periodontal treatment. I use it for other soft tissue management. The biostimulation effects are really helpful when it comes to post-operative care for patients. And if there's any paresthesia after a procedure, it really does help heat the tissues to stimulate them and regenerate a lot of growth that might otherwise not be possible or require many other physicians or doctors to step in. From my standpoint, I truly feel that LANAP is the way of the future. It's a very minimally invasive technique, which is not only on trend right now, but is actually the way that all medicine and science are going. We don't have to be as exploratory anymore. We have technologies like 3D analysis. We have technologies that will help us be so much more accurate in our planning, that using LANAP to treat them increases that accuracy, increases the efficiency of your treatment for your patients, for yourself, and is truly, I think, paving the way for all of periodontics and periodontal treatment in the future.